From the lumen out, the histology of blood vessels includes the tunica intima, endothelial lining structure, tunica media containing smooth muscle that achieves vasoconstriction and dilation, tunica externa, CTP layer, in thicker blood vessels, including arteries and veins. The tunica externa will contain vasa vasorum, a built-in blood supply for the vessel itself. Arteries are blood vessels that carry blood away from the heart, and veins bring blood back to the heart, regardless of the level of oxygenation. Arteries include the largest arteries, elastic or conducting. These would include the aorta and all of its main branches. Elastic fibers within the media are dominant to provide stretch and recoil. Muscular or distributing arteries would be all the other named arteries with a very thick muscular layer, tunica media, that will allow them to distribute blood to specific organs. Arteries versus vein comparison, slide 1. Arteries have much thicker walls than do veins, and typically a smaller lumen than veins. Same holds true for arterioles and venules, essentially smaller arteries and smaller veins, respectively. The arterioles have a thicker wall, smaller lumen, venules, thinner wall, and larger lumen. Veins return blood to the heart, and especially in the lower extremities, have various valves to prevent blood from backing down from where it came. Capillaries include continuous, the most common, least permeable, especially in the BBB, which stands for blood-brain barrier, where tight junctions are especially numerous. Pericytes are cells that support the thin endothelial walls from the outside. Fenestrated or windowed capillaries have fenestrations to allow for greater permeability. These are present in kidneys, small intestine, and the endocrine glands. Sinusoids are the largest of all of the capillaries present. Liver, spleen, and bone marrow, they have large intercellular clefts and also fenestrations to allow for the most permeability. Capillary beds are networks of true capillaries, at the bases of which are smooth muscle cells known as precapillary sphincters. A terminal arteriole is the smallest arteriole leading into a capillary bed. Postcapillary venule is the smallest vein leading out from the capillary bed. Medarterioles are intermediary in structure between an arteriole and a true capillary, whereas thoroughfare channels are intermediate in configuration between a true capillary and a postcapillary venule. When the sphincters are open, blood flows through the true capillaries in that capillary bed. When a shunt is created, the sphincters close down, clamp down, so that blood is more readily shunted from the terminal arteriole through the medarteriole thoroughfare channel and out through the postcapillary venule, primarily bypassing most of the true capillary network. Aorta, 3 parts, ascending aorta, off of which branch the coronary arteries. That was discussed when we talked about the heart. The arch, 3 branches coming off of the arch, brachiocephalic, left common carotid, and the left subclavian. Please notice that the brachiocephalic trunk is an artery, almost immediately branches into the right common carotid and the right subclavians. Descending, bringing blood down, part of the aorta includes descending thoracic and descending abdominal aorta. The last two slides indicate the major systemic veins and major systemic arteries. We will go through these one at a time during a Zoom lecture on this topic. Again, this slide shows the major systemic veins, and this slide shows the major systemic arteries.